Thank you, Ceann. I'm glad to get the opportunity to speak on this very important, I suppose, the most important aspect of that we have to deal with in this chamber. I suppose you all know that the Health Service Executive, the HSE, was put in place in January 2005, and I believe, and a lot of other people believe as well, Ceann, that since that happening, our health service has deteriorated, and to such an extent that it's in a total shambles now. And I don't, nobody knows, I don't know how it's going to be redeemed or how it's going to be retrieved or what's going to happen to give people confidence back in our health system, because they clearly don't have it at the present time. Minister, we have 5 ministers for health. We have a government, we have a Taoiseach, we have a president, but we don't have a health service. We don't have enough nurses, and what nurses we have when they're not being properly paid. We don't have enough doctors, we don't have enough consultants. Indeed, I know of one patient, just one patient, that's waiting for 3 years for a surgery and in this country. And he can't get it because he's a public patient, and the consultant that was dealing with him at the start went into private practice, and he hasn't been replaced since. That's a fact. That man is sitting in an armchair, kind of half standing up. He can't lie down, and he can't sit properly. He must kind of try to stay half standing. That's the way his days are, day in, day out. There's no accountability. That's what's wrong. And you take the likes of Kinmare Community Hospital. It's open 4 or 5 years now, and indeed I give credit to one man and to no other person, and that was Jackie Healy-Rae. He fought so hard to get that community hospital for Kinmare, and lo and behold, it's only half opened. It's not even half open. 21 beds are still not open in that hospital, in that community hospital. The same story with Dingle, a new hospital for Dingle. A local farmer gave the government the ground for the new hospital free of charge, and half the hospital is only operating at the present time. There's offices, if you please, in other parts of it. So that's what's happening in Kerry. And in all the summer, 22, 23, 24, 5 patients and trolleys day after day, all the roasting summer, and that's what was happening down in Kerry. And what's it going to be like before the springtime if the winter gets bad? The big worry that I have for the people of Kerry is we're promised a new hospital for Killarney, but if this children's hospital in Dublin is going to double its cost, will the funding be there for it? Carers, people have to wait, as was said already, 6 months for carers, and elderly people like to stay at home as long as they can. In fact, they'd like to die at home. That's what they want. And it's not fair that people have to wait 6 months to get carers. Private health insurance. Look what's happening with that, Minister. A patient goes into hospital tonight, and as soon as possible, someone comes into him or her and to see is he on private, are they on private health insurance. The minute they are, whatever health insurance cover they have is charged over €800 for that night or for that stay in that hospital, whereas it would have only been 75 up until that. What is that doing to private health insurance, Minister? Only driving up the cost of it, driving it beyond the reach of the working person, and who would dearly like to have proper cover for the family, and it's not attainable now because of the costs. People in pain, and people going blind. We're taking buses to Belfast week after week, whether it is cataracts, hips, knees, tonsils, so many different things. and they can be done in Belfast, but and they can get the money back from the HSE when they come down, but we can do them in our own hospitals in the south of Ireland. Why is it, Minister? I don't know if you're listening to me or not, and I don't know if you really care, because you made a statement there a few weeks ago where that in 20 years' time there'd be no nursing homes in Ireland. Where are we going to go with the people then, Minister? What are we going to do with them? If we're going to close the nursing homes, what other place have we for them? So, I'm sorry, I'm after going beyond my time.
Deputy Michael.